COVID-19. This is a 30,000 foot view and updates that I'm not going to go into with regard to treatment or prevention and herbs and so on and so forth. Those are other videos I've done and will do. What I'm going to focus on are just some mistruths that are being perpetuated out there by people who don't know and or think they know and or, well, mostly well-meaning people, I think. And these are the truths that I'm going to share with you are truths that I had before, and then I honestly, as the dude said, my thinking on this had been very uptight and I'd kind of forgotten about it, and then I talked to my mentors and colleagues and reminded me about, hey, we can handle this. This ain't our first rodeo for traditional medicine dealing with pandemics, and here are some of the basic just understandings of thought, not of treatments, just 30,000 foot level. So currently, as you well know, there's a lot of fear and there's a lot of misinformation out there, and we're going to address truths here and some of the fallacies. Fallacy number one, all we can do is cling on to our masks and gloves and sequester ourselves in our home and wait for Bill Gates or someone else to deliver us from this peril, which is COVID-19. No, I'm not willing to accept that reality because it's not a reality, and you shouldn't accept it as a reality either. You should empower yourself with tools that can deliver yourself from not just COVID-19 fears, but the same things that I'm going to mention and briefly overhead 30,000 foot level are the same things that would protect you against other pathogens and other diseases. Fallacy number two, your immune system's nice, but it's not able to fend off everything. That's not the case either. Another fallacy, healthy people are getting sick and dying of COVID-19. No, not quite either. So let's go into the immune system. First of all, it's not really just the immune system. In reality, it's an interconnected, beautiful mess of your immune system, which by the way is located largely in your gut. So it's the immune/gastroenterological, which is also connected to your endocrine system, which is also connected to your nervous system by a lot. It's your second brain. And as Willie Morris, good friend, also points out, and rightly so, that it's also connected to the psychosocial. So, your community is also a part of the things that affect your immune system. So that's the first thing to kind of wrap your head around, that it's big. Secondly, some people will say, Oscar, you're not an immunologist, you're not a virologist. True, but in reality, the people who are immunologists, and I know some, say the same thing, that they don't really know what's going on either. They keep finding more pathways and more interconnectedness. And this is something that traditional medicine has really gotten a hold of conceptually for a very, very long time, the interconnectedness of things. I am a practitioner of Chinese medicine and other traditional systems of medicine in the world that have been around a very long time that have these intrinsically woven into their thought processes. C, here's the biggest one. When functioning properly, the immune system can and does make it so that we can fight off anything smaller than a lion without symptoms, yes, including COVID-19, and we can develop immunity to it. So I don't think COVID is a lion. I also don't think it's a tiny kitty cat, but maybe a bobcat, and we can certainly have a healthy respect for bobcats without getting mauled by them. So I know it's hard to believe that the immune system is badass and can fight off just about anything, and the same kind of thinking is, well, just because you don't see it very often doesn't mean it exists. Just because there's a lot of fat people in America doesn't mean fat people are normal. It is something that we need to address. So difference between, common and a normal. So a normal is to have a kick-ass immune system. Natural medicine, traditional medicine, I think, can help you do that. Again, not going to go into the specifics of how. I have in other videos and I can in future videos. Healthy people are dying from COVID. No, they weren't healthy. Those aren't the people that were dying from COVID. Yes, maybe they had COVID. Maybe they didn't, actually. Maybe they had a bobcat chawing, chomping on their ankles. That's not what killed them. They probably also had a rabbit, in their carotid artery, maybe 7 of them, and they died of all of that, not just the, bobcat that may have been gnawing on their ankle. So there's that. There's some pretty good evidence. It's just that these aren't healthy people. Just because they weren't technically diagnosed with a diabetes or a heart disease or a COPD don't mean that they were healthy. And we see this all the time. Their vitamin D levels are low and so on and so forth. Their inflammatory levels are low, but they're walking around like it's fine. A lot of people just don't know what health is. Terrain theory. So this is a departure from what Western conventional biomedicine is, just completely obsessed with pathogens, be it a virus in this case, or a bacteria, or a fungus, or a parasite, some kind of beastie of some sort. And I would also add to that the same kind of thinking for cancer, even though it's not technically a living, a different entity, but the approach is still the same. You know, how do you cut it off? How do you kill it, excise it, you know, burn it off with radiation? How do you just get rid of the beastie, the thing, and just kill it? Well, you know, there's some validity to that line of thought, and there are certainly herbs and natural things that are antifungal, antibacterial, antiviral, and by the way, not all viruses, not all bacteria, not all fungi are pathogenic. We know that there are some oncolytic viruses that, you know, are bad, just like we know that there are some bacteria that people are buying out there and putting them in their mouth and other places, and they help improve our internal diversity of microbiome and ecology, the terrain. So terrain theory, Antoine Béchamp back in 1800s or so, French guy, white of course, and like many things, is when a white guy discovered is it's all of a sudden discovered. Of course, this has been around for thousands of years and is intrinsic to natural and traditional medicine that has been around for forever. So, but whatever, he coined the term. It's pretty cool stuff. It's a different viewpoint. So I'm not saying to ignore the pathogen, in this case the virus. What I'm saying, a bigger part of the puzzle is, and the questions that we really ought to be asking are, what kind of terrain are you creating and cultivating? If this thing is maybe not a blowtorch, but not quite a spark, if it's maybe, you know, a little gas station butane lighter, are you cultivating a field of dried grass and highly flammable dryer lint, or are you cultivating a field of watermelons and Chuck Norrises? Because you can cultivate those. So a lot more to say, but that's the big takeaway is you can have both systems of thought, believe that there is a pathogen, yes, but also believe that you can do a lot more than just wait for that pathogen to kill you, and or a ventilator, or, you know, these things are outside of us. You can be empowered and create and develop your own terrain. We can help you do that. These things are not difficult. They're simple things, but there are a lot of them. And so I recommend that you find someone that can help you first assess your terrain, and secondly, get it balanced. That's the big takeaway here.